Welcome to the Cornell Cooperative Extension Dairy Herd Health Troubleshooting Podcast, a podcast series focused on how to go about looking into health issues on a dairy. Each episode will discuss a different area on the dairy where herd health can be impacted. This series has less to do with providing answers to problems. We'll be talking about how to be more successful in your investigations.
Welcome to Troubleshooting Herd Health Issues on Your Dairy. In this episode, we're going to be talking about troubleshooting mastitis. I'm Kathy Barrett with Cornell's PRODAIRY program. And with us, we also have Rob Lynch. Hey, Rob.
Hey, Kathy. Hi, everybody.
Rob is with Cornell's PRODAIRY program as well. He is our resident veterinarian and our herd health management specialist. So when Rob and I were getting together to talk about this episode, right away, Rob mentioned that he thought Quality Milk Production Services was ideal for this topic, and Dr. Matthias Wieland in particular. So we're fortunate Dr. Wieland was able to join us for this next 30 minutes or so to talk about troubleshooting mastitis. So welcome, Matthias.
Hello, thank you very much for the invitation. Hi, Kathy. Hi, Rob.
Matthias, would you start out just a little bit about your background and then talk a bit about also what Quality Milk Production Services does?
Sure. So I'm a veterinarian with Quality Milk Production Services. I'm an extension associate. I joined QMPS in 2017. Before that, I worked for a couple of years with ambulatory clinic here at Cornell. And before that, I worked at the clinic in Germany after I graduated at the university in Munich, Germany in 2007. Here at Cornell at Quality Milk Production Services, in my role as an extension associate, I'm responsible for the field work, the field services here in Ithaca, together with Anja Sipka, who is also doing extension work, and together with Carrie Case and Christina Geary, who are both field technicians. We are part of the College of Veterinary Medicine here at Cornell. And our mission is to promote the quality of milk by reducing mastitis in dairy herds in New York State. Once in a while, we cross the border, but our main focus is certainly to help New York State dairy farmers. To achieve this, we're organized in 4 different labs. So we have one central lab here in Ithaca, and then a western lab in Warsaw, a northern lab in Canton, and last but not least, we have a lab in the eastern part, which is located in Codalskill.
So yeah, I really did think of QMPS first when we talked about covering the topic of mastitis troubleshooting. QMPS really covers it all when it comes to milk quality. You want to maybe just mention a little bit about all the different services QMPS offers, Matthias?
Sure, yeah. You should think about QMPS first when it comes to milk quality, and you are located in New York State. The field services are best described by the 2 following services. And this is what I believe it started with, is the so-called full herd survey. And it is basically comprised of and based on the milk sampling. So all lactating cows on the day of the visit will be sampled for bacterial culture. And there we can do aerobic culture for the main mastitis pathogens, but also mycoplasma culture if there is a suspicion that a farm struggles with that specific pathogen. It's not limited to milk sampling. We also have a close look at the equipment. We do check whether the milking parlor is in line with current industry recommendations, look at the different settings. We also make sure that the farms have the opportunity to revisit their milking routine, and that involves not only the timing of the pre-milking udder preparation, but also teat sanitization and so forth. And then we also have a close look at the facility to do a risk assessment to identify the major opportunity areas or identify the major factors that could contribute to an increased mastitis risk. Some farms also have DHI test day data on a regular basis if they are enrolled, including the somatic cell count information. And if farms do that, we also have a closer look into that. The second part of our field services is the extension surveys which is basically very, very similar to the herd surveys, with one exception, basically, that the milk sampling part is not included. Usually we perform those extension surveys on larger farms with several hundred or several thousand of dairy cows. And that means that we have a closer look into the dairy comp data, test state data. Many farms participate in that program upon a certain size. We'll look into the clinical mastitis data. And if they send in milk samples on a regular basis to a lab and the data is downloaded onto their dairy comp, then we'll also look at the culture data. The same is true if they do on-farm culturing and they are keeping good records of those culture results that they obtain from their own on-farm culturing. Then a second focus is, of course, then the milking equipment, again, the milking routine, and the risk assessment. So these two, the full herd survey, including milk sampling, plus the extension surveys, are basically the two main categories that we provide, in addition to other services based on demand. If farms, for instance, struggle with a PI issue, if milk quality is not in line with the current recommendations or the requirements of their co-ops, then we're certainly going out and assess the system in terms of a wash analysis. But I think that covers it pretty well.
Yeah, it almost sounds like the extension survey, if the farm is checking these areas on a somewhat regular basis, maybe they can prevent that mastitis outbreak that we're going to try to troubleshoot here in a minute.
Yeah, so that's actually our goal. It's not that we go out only once a year to those farms. We actually try to provide a regular service, because dairy farm of those sizes, they change basically the management or adjust the management on a daily basis. So we try to go out as often as possible, 3 to 4 times a year. And that provides them a good baseline data, a good data set with which we can work with. And then also try to prevent disasters from happening. That's actually our goal, to be there, identify opportunity areas to fine-tune and continuously improve milk quality and udder health on those large dairy farms.
Yeah, I mean, the unfortunate circumstance that happens too often is those clinical cases start adding up, and cows coming in, they're showing bad milk, and you're getting more and more cases, and all of a sudden you feel like, all right, I'm in an outbreak situation and I need some help. It'd be nice to identify those risk factors before that's the case. But if that's not how it all shook out, and now we're looking into a clinical mastitis outbreak scenario, it's overwhelming. What are the steps that you think of as far as what do we need to understand to know why this outbreak is occurring?
We do have, in those scenarios, when a farm contacts us and tells us we have since for 3 or 4 weeks now, or sometimes longer, an outbreak of clinical mastitis. Then we try to have a targeted approach, and most often we start with analyzing their herd record or health record data. Most often it is the dairy comp data. So we can easily download a backup file and then chime right into the clinical mastitis data. If they have any culture data available, we'll look into that. And obviously, if they are included or participating in the DHIA test state data, we're also having a look into the somatic cell count data and look into what can we learn and see and interpret from that already.
Matthias, you have a chance to look at a lot of herd records and data. There's got to be some common errors or problems that you run into and you wish farms would do a better job on their end when they're capturing this information.
Oh yeah, definitely there are. The first are the somatic cell count data. I'll give you the specific example. Somatic cell count data after testing are not processed by one single organization, but several. And there is a little bit discrepancy between how they enter the data into the dairy comp. And specifically, some organizations include information of cows with 1 to 3 days in milk, whereas others don't. The reason and the argument of organizations who don't is that there's a lot of variation over the first 3 days in milk. So we do not know how really to interpret that data from cows that early in lactation. So the first thing that we always have to check is whether the records include these cows or not. So more consistency on that side would facilitate the interpretation on that on the long run. We can do that to some extent by changing the command, but certainly it would be easier if it was consistent across all farms. When it comes to clinical mastitis records, and then what we very often see is that farms are not entering all cases, but only the ones who are treated. For instance, imagine a farm is doing on-farm culturing. They treat only the gram-positive cases of mastitis once they receive the culture result. And then oftentimes the farm management is only entering the cases that are being treated. And that means that the documented cases of clinical mastitis are erroneously low compared to the reality. And we have to ask that question every single time before we do the analysis, whether these cases are reported or not. So certainly that would be a point where there is some opportunity. And last, on several farms that are doing on-farm culture system, I see on a regular basis that there is some inconsistency regarding the recording, which makes it then difficult to analyze that data. It's certainly possible, but it would be way easier if there was more consistency when it comes to entering the data.
Yeah, certainly you want to be dealing with accurate information, complete information when you're doing that kind of analysis. And so after you've had a chance to go over the historical records, what comes next?
So I think we have to go back to the culture data real quick, because not all farms have the possibility to send in milk samples from clinical cases from fresh cows or high somatic cell count cows on a regular basis. So once in a while, we are faced with a farm that does not have any culture data whatsoever. And then a second step would be to initiate a sampling protocol. And based on the main concern of the farm, whether it's high somatic cell count cows, so subclinical mastitis, or clinical cases of mastitis, we start coming up with a protocol to identify the pathogen that is involved. So that means in specific that we ask the farm to send in milk samples from clinical cases, eventually from fresh cows, or from high somatic cell count cows, depending on what is going on the farm. Let's imagine it's a farm that struggles with clinical cases, so then we'll start with culture results from clinical cases. So this is an essential part to identify the pathogen that is involved in that clinical mastitis outbreak or mastitis outbreak. In addition to that, because, for instance, for mycoplasma, which is very difficult to isolate and which can be masked for a while, we also ask the farm to send in a bulk tank sample just to have an additional backup or assurance or information whether the farm is struggling with a mycoplasma case.
Yeah, kind of have to know what the enemy is. We're going to come up with a solution.
And after analyzing the clinical mastitis data and the culture data, we do have most of the time actually a pretty good idea on what we're dealing with. As you mentioned, you have to know where the enemy is, and also we have to know which cows are affected. So in other words, is there a specific group of cows? Is it first lactation animals versus mature animals? Is it early lactation cows versus mid or late lactation cows? So are all cows equally affected? Or again, is there a specific group that is predominantly affected by the mastitis cases? So that helps us to apply a targeted approach and helps us identify opportunity areas when we then finally go out to the farm and perform a full extension survey, because we still want to cover everything. So a targeted approach is certainly valuable. But if you're leaving out too many options and you're not collecting the data properly, you're always asking questions. So we want to cover everything with having the targets in the back of our heads.
So Matthias, at this point, you've discussed all the information that you gathered. And I'm wondering, what's the process when you actually get out to the farm?
That's an excellent question. Actually, in the meantime, while doing so, before we go out to the farm, I forgot to mention that previously, is that we would like to have a troubleshooting team on board. So, and that includes the herd veterinarian, in many cases also the nutritionist, farm management, as well as the equipment dealer. And the reason is because we want to have a good discussion about the pros and cons of every single finding or opportunity or suggestion that we make. We would like to hear everybody's opinion and then make a joint decision to improve milk quality or solve the issue on the farm. If you're trying to do that on your own, it is, first of all, less enjoyable and most often less successful. So having a strong team with everybody pulling in the same direction will be the key to success on a cropland and on large and small farms that are struggling with clinical mastitis or subclinical mastitis cases.
Yeah, these issues tend to take several months, if not longer than that, to resolve. So getting everybody working together and following up really increases the odds of success.
Yes, definitely they do. And what we also recognize is that there will be an improvement. And then when, for instance, season changes, then you may have some deteriorations again, or you're falling back again. And if not all team members agree to a decision, then it starts getting difficult to continue on that track. So it's good to have that team approach. It strengthens the decisions and the ideas and helps improving the situation on the farm, definitely. So I try to go out to the farm. We're usually there for an entire milking shift. And depending on the farm size, the parlor size, it is usually 2 or 3 people. And the reason is because we try to cover it all on one visit. Once in a while, we'll split it in 2 on the very large farms in our region. But usually we're good and confident that we can collect enough data on a single visit. It's a long day because we're there for an entire milking shift. And there we try to evaluate the milking equipment. And when it comes to milking equipment, there are a couple of parameters that we're making sure that are in line, first of all, with the farm goal, but also with the industry recommendations. If there are any red flags, we address them immediately together with farm management. And these include, for example, the vacuum setting. So we know that cows want to be milked at a certain vacuum that is applied to the teat. We don't want to be below, but also not above that value. And so we measure the vacuum that is applied to the teat and refer to that as the average claw vacuum. If the vacuum is too high, we know we're inducing too much teat tissue damage. And we say a cow can acquire clinical mastitis in 4 ways: the right front, the right hind, the left front, and the left hind. And so making sure that the teat is nice and happy helps preventing mastitis. If vacuum is applied to the teat, there's too much damage that impacts the defense mechanism of the teat. So we want to make sure that we're in line or in a range that we're feeling comfortable and that we know that the teat tissue can recover until the next milking starts. That would be one point. The other part on the milking equipment is the vacuum regulation. So in a milking parlor, imagine there are 2 milkers, and every time a milker attaches a unit, there is some vacuum loss. So the milker starts the button, and then air is sucked into the unit, and that creates vacuum fluctuations on the cows that are being milked at that very moment. So we need to make sure that that vacuum fluctuation is within a certain range and doesn't exceed the industry recommendations. So that would be the second part. We want to make sure vacuum regulation doesn't exceed a certain value, which is slightly different from the absolute value of the vacuum. And then I mentioned the damage that can be made to the teat tissue during milking. or the changes that can be made to the teat tissue during milking. This is actually the job of the pulsation system, to massage the teat during the milking process. And this is why it's so important that we also have to make sure that the Pulsator settings are in line with the current industry recommendations, but not only the recommendation, but also ask the cows how they're feeling. And this is what we do at the farm. We have a close look at the teat tissue after the unit comes off, not only evaluate the Pulsator settings, but also ask the cows how they're feeling by evaluating the changes that occur after milking. The fourth part that we're also looking into when it comes to the milking equipment is the takeoff settings. Most farms are working with automatic cluster removers, and there we make sure that they are set at a level that the cows are not being overmilked, but we're also not leaving milk in the cows and leave milk on the table. So we're fine-tuned that by performing the strip splits. And I believe that would be it. That describes the evaluation of the milking equipment fairly well. That's, however, only one part.
This is a good place to stop, Matthias, and we'll pick up with part 2 on troubleshooting mastitis in our next episode. So Rob and Matthias, thank you very much for an interesting discussion, and I would encourage folks to tune into our next podcast episode where we talk more about troubleshooting mastitis on your dairy.
Thanks for listening to this herd health troubleshooting episode. You can find more episodes like this one on the CCE Dairy Educator channel on SoundCloud or on the PRODAIRY website, along with many other resources.